Hello everyone. So today we'll discuss about the various types of vaginitis, causes, diagnosis, investigation, and how you treat it. So first we'll study about normal vaginal discharge. So normal vaginal discharge is made up of glandular secretions. Glandular secretions of which gland? Sebaceous gland, sweat gland, Bartholin gland, skin gland. Apart from this, number 2, there is cervical mucus. Number 3, transudates of vaginal walls. Number 4, there is exfoliated vaginal cells. Number 5, various microorganisms and their metabolic products. So this is the normal vaginal discharge made up of. Next we'll study what is the normal pH. The normal vaginal pH is less than 4.5. Why less than 4.5? Because of lactic acid producing bacilli, lactobacillus. Now vaginal flora, normal vaginal flora is predominantly aerobic in nature. So there are mainly 6 different species, out of which most common is lactobacillus. Now this lactobacillus is hydrogen peroxide producing. So there is estrogen stimulated vaginal epithelial cells. These are rich in glycogen. So this glycogen is converted to monosaccharides by this vaginal epithelial cells itself, which is again converted to lactic acid by this vaginal epithelial cells as well as lactobacillus. So thus vaginal pH is maintained to a acidic level that is less than 4.5. Now next we'll discuss about the various types of vaginitis, out of which the most common is bacterial vaginosis. So why not calling it vaginitis and vaginosis? Because there is no inflammation. Therefore, we are calling it vaginosis. So since there is no inflammation, there is no itching. So if any patient comes with a discharge and says that, yes, doctor, I have got a discharge, but there is no itching, so you may suspect it as bacterial vaginosis. So it is again not an STD. So since this is not an STD, therefore, male partner treatment is not recommended. And not required. So what happens in bacterial vaginosis? So bacterial vaginosis, what happens? There is alteration of the normal flora. So what do you mean by this alteration? What happens? There is decrease in the concentration of lactobacilli. Therefore, it is aerobic nature. It is to maintain the aerobic nature. So there will be predominance in the anaerobic bacteria. So which are the anaerobic bacteria? So, one is the Mycoplasma hominis. Next is Gardnerella vaginalis. So these are the predominant organisms causing bacterial vaginosis. So what happens? So once bacterial vaginosis, one important thing is it is polymicrobial. Okay. So it is polymicrobial, number 1 point. Number 2 is there is alteration of normal flora. Number 3, there is increase in the concentration of anaerobic species and decrease in the concentration of lactobacillus. Now, since there is decrease in the lactic acid, therefore pH will be more than 4.5. Again, next is what are the main symptoms? Patient will come with what complaint? So patient can come with the complaint of foul smelling discharge, foul smelling or fishy smelling discharge. So patient can come with this complaint. No itching, and this is more common after coitus. Okay, so patient can come and say that after sexual intercourse they are having foul smelling discharge. Number 3, since there is no inflammation, there will be no itching. How does the discharge will look like? The discharge will look like dark. It will look like white. It will look like dirty white or grayish. Not dark, dirty white or grayish discharge. So these are the main 4 things we have to remember. Now, what is the diagnosis? What is the main investigation of choice? So the main investigation of choice is microscopy. Saline microscopy. Saline microscopy will show clue cells. What are clue cells? So clue cells, clue cells are the superficial epithelial cells coated with bacteria. So this is what we call as the clue cells. So this is the diagnosis of choice. Now, what is the gold standard? The gold standard is gram stain. On gram stain, what we do? On gram stain, we do Nugent scoring, which you don't have to know in details. On Nugent scoring, if the score is more than equal to 7, it is suggestive of bacterial vaginosis. Next, what is Whiff test? There is another important test, that is Whiff test. So what happens with the vaginal discharge? If we add KOH to the vaginal discharge, amines are produced. These amines gives what? These amines will give fishy odor. So we have to remember whiff taste in bacterial vaginosis. Next is how will you treat? So next is the treatment part. So treatment will divide it into non-pregnant female and pregnant female. So in non-pregnant, the two treatment options are metronidazole. Another treatment option is clindamycin. So our drug of choice is metronidazole. So what is the dose we give? The dose is 500 milligram BD into 7 days. Now, since male partner treatment is not required, we are not recommending the treatment to the male partner. And you can also give clindamycin suppository or clindamycin cream. In case of pregnant females, what is the drug of choice in pregnancy? The drug of choice is again metronidazole, but metronidazole is not recommended in the first trimester. And again, there is no need of treatment to the male partner. Next, we'll move on to. So now the last part. So we have to now know how we can prevent. So in order to know the prevention, we have to understand the cause. So cause is basically alkalinization of vagina, leading to decrease in the number of lactobacillus. So alkalinization occurs due to frequent sexual intercourse, due to douching, due to antibiotic use. Now, how we can prevent? So in order to prevent this, we have to use condoms. Number one, we have to avoid douching and for antibiotic use. But if there is any infection, for example, let's say we have sore throat, viral infection, or any infection, we have to use antibiotics. Now, what does these antibiotics do? They kill systemic bacteria as well as they also kill some of the vaginal flora. So in order, we have to limit our excessive antibiotic use. So these are the things we should know for prevention.